And good afternoon. It is Friday. It is our Lunch and Learn. And if you've been following our posts, you know that we're going to be talking to you about the McLaughlin scar tissue release therapy today and why you need it. Okay. And you may think that you don't need it. And you may think that your scars are not bothering you, but I'm just here to tell you from a personal and a professional basis that you might not be right on that. So if you know me, people that know me know that I had scoliosis surgery when I was 12 years old. And so that was a minute. It's been a minute since then. And I would tell you, if you ask me, are you having or did you have any problems with your scars? I would say, no, I'm not having any problem whatsoever with my scars. And I saw a video, which we'll try and find that and post that, or if somebody who is watching and loves me knows what that video is and they can post it on the comments, that would be great. But I saw a photo or a video of a young woman. She was a preschool teacher and she was sitting on the floor. And she was having a very difficult time rising from the floor. I would say this lady was in her late 20s, maybe early 30s. And I watched as she struggled to get up off the floor. And I thought, oh, I can really relate to that. And then the next video was her just popping up off that floor like there was just no problem. And I thought, okay, that kind of therapy I want to know about. And so I reached out to an instructor that I know. I've known her for 20 years. And I said, look, I want to learn this therapy. She said, great, I'll come to Houston and we'll have a class and I'll teach you this therapy, which was amazing. And so I will just tell you, as someone who thought her scars did not have any impact in her life today, because after all, they're 50 plus years old, then when I did this therapy the first time, I started crying. Now, I was not hurt. There was nothing going on. There was nothing painful about the therapy. But as I was lying on the table, tears just started rolling out of my eye. And it was like, what is this about? And the therapist told me it is the trapped emotion that is in the scar. Every time you wound yourself, every time you have a surgery or a trauma or whatever. I mean, life is kind of hard sometimes. I've had car wrecks. I've fallen down. I've had surgery. I've had 2 births. If you don't think that's traumatic, well, okay. So we all have these things in our life, and we don't understand that even though the body can heal, and thank you, Jesus, that it does, there are extended ramifications from that. So one of the statistics that I want to talk to you about today has to do with surgeries. Now, these statistics are from 1981 to 2015. And this is only here in the United States. So this is not anywhere else in the world, but you can extrapolate in your area, or you can look at your own statistics and that kind of thing. So the annual number of surgeries, all right, annual number of surgeries. In the inpatient, that would be you go in and you stay overnight, 10 million a year. Outpatient surgery, so that might be your laparoscopic surgeries, that might be your dental surgeries, it might be your cataract surgeries, whatever, you're in and out in the same day, outpatient, 18 million scars. And so then you've got total all that, that's 28 million surgeries per year. That's a lot. In my case, when I had my scoliosis surgery, I actually received 2 scars. One down the whole length of my spine, because my spine was fused together, if you don't know what scoliosis is. And one of the things that they had to do to make paste to glue my vertebrae together, all right, is they took a bone graft out of my hip. They took that bone graft, they pulverized it, they mixed it with my own blood, they pasted all of my vertebrae together in a straight line, or as straight as it could be, because that's what scoliosis is. It's an S curve. I actually had a double S curve. Yes, I know, I'm an overachiever. And when I was 12, they went in, and so I have 2 scars. Now, as I said, I would not have told you that those scars were hindering me. However, we do have photographic evidence that shows before and after treatment, which is just amazing. So one of the things I want to do today is to explain to you what scars are and kind of go into the anatomy of the body so you can have a better understanding. We have all these medical shows that are on the television. And so when a surgeon slices into the body, one of the things I seem to see a whole lot of is a cesarean birth, right? They slice down through 7 layers of skin. That's a lot, okay? That is a whole lot. So you've got your outer skin, right, which is where you see the scar on the outside of the skin. But then you've got muscles and bone and organ, but you've also got a covering on your muscles called fascia, okay? Fascia is kind of slippery, and it's what makes your muscles slide on top of each other so that your body, has movement. Yes, your bones are moving, but you've also got that fascia in there. And so as a kind of visual aid, I have a lemon. Now put the lemon right up. Did I find out where my camera is? There it is. You can see those white segments in the lemon. And we know that if we peel this, that we could peel those white segments off. Well, those white segments would be analogous to the fascia in our bodies. If you have a steak, if you cook in your home and you cook steak, which I do, when you open up the package and you've got the steak and you've got that white marbling in there, and you've got those white kind of silvery bands or ribbons that is in the meat, that is fascia. It's what causes the muscles to be able to move. And so when we have surgery, we cut through that fascia, and when that fascia knits back together with collagen, all right, we need collagen to knit us back together. When that fascia knits back together, it knits back together in a kind of a crooked, chaotic way. So in your body, with no scars, all right, so we're going to take this part of my body because I don't have any scars here. So in my body with this part of my scars, in this part of my body with no scars, everything on the inside just moves very, very, very easily. When you have that fascia that is pierced and penetrated, then you have that scar tissue, and the collagen, instead of laying down nice and smooth like you see my neck is, that collagen goes like haphazard, right? Because it's trying to rebuild, and your scars are ropey. They can be ripply. They can be raised like a keloid. There are all kinds of things that can happen to the scars. So when you see my scar, or you look at your body and you see a scar, I actually, on one of my thumbs, it's almost gone by now, but I actually dropped a file folder. I was working in the legal office and I dropped a heavy file folder on my thumb, and it split the skin. Didn't have to have stitches or anything like that, but I did have a scar. So when that happens, the collagen goes in a mishmash way, and then you've got the evidence of the scar. What you're not seeing is, just like an iceberg, we see this much, and then underneath the surface of the ocean, we've got this much. Same thing with your scar. You see what's on the surface, but you don't see what is underneath. And so this is why you're thinking, when you're looking at your scar, you see what you see on the surface of the skin, but you're not seeing all the stuff that's in the back or underneath part of the scar, especially if you've had a C-section where they've gone through all 7 layers of your skin to get that little baby out. You've got scars all the way down there, okay? And so that's what we want to talk about. When that happens, the fascia contracts and it impedes the movement. So what does that look like? That looks like constipation. That looks like IBS. That looks like I'm not digesting my food. That looks really ugly in a bikini. Just going to throw that out there. That looks like no libido. That looks like no rapid response time sexually. So there's just a lot of things that happen in that particular type of scar. You may not have had a C-section, but you may have had your tubes tied. You may have had an appendectomy. You may have had endometriosis. When all those things are going on, you're getting that same kind of scar tissue issue that's down there. And so we don't know that. Well, we do now because we took the class and we got certified and all that. We know that when you do this specific kind of treatment, that it has been scientifically proven by ultrasound that the depth of the scar diminishes, the rippling of the scar diminishes, the color of the scar changes, and movement that has been impeded is restored. And so that's what this is just, I mean, I'm just like doing the hallelujah dance because so many people we know, 28 million people per year are having surgery, right? How many other people are in car accidents where they have trauma and they have scars? So this technique will work on the scars surgery, the scars from trauma, even self-harm scars. This will work with that to relieve that and get you a greater range of motion. And so I'm really, really excited about this. Now, I wanted to talk to you about the traditional Chinese meridians. And why do I want to talk to you about that? Because I got to see which page that's on. We do a lot of energy testing, right? So if you're in here in the office, we do a lot of energy testing. And so what we are testing is the traditional Chinese meridians. So this particular scar tissue technique uses and releases the life force that we all have. Now, I don't want you guys to think that, oh, we're getting into all new age and all that kind of stuff, because we're not. This is the way the body is made. Western medicine does not teach us this, but that nonetheless does not make it not true. So Chinese doctors believe that for good health and to maintain the body's life force, pronounced chi, C-H-I, or X-I, depending on how you do it. And that is, for us Christians, right, that is the Zoe life of God. It is how we move. It's how we breathe. The scriptures say, in him we live and move and have our being. Chinese call it chi. Christians call it Zoe. We don't care what you call it. What matters is it moving, okay? Any interruption of the flow can cause stagnation. They believe that the flow should be unimpeded like water flows in a river. The lack of energy in a specific place along the meridian can cause dysfunction and illness. There are 12 major pathways in the body, and there are 2 governing vessels in the body. So I'm not going to go through all the time to talk to you about all that. We just want you to understand that there are those points. We work with those points when you come in here into the clinic. But what we want to do is we want to give you a little study so that you can kind of wrap your mind around this, because I know this is kind of like you're thinking that I'm crazy. Each acupuncture point has a specific name and a location along the meridian. The acupuncture points are numbered, and in the simplest form, the acupuncturist finds out where the chi is and figures out what to do with it. So we're going to give you a case study of a lady. This is a lady, she's 44 years old, and she experienced dysmenorrhea. Now, dysmenorrhea is a medical term for very, very painful periods, extremely painful. These are the kind of periods that, you know, you're like cramping for 2 or 3 days before. You might even have to stay home from work because you just, or stay home from school because you just can't function. I didn't have that. Thank you, Jesus. Mine was just easy come, easy go, no big deal. However, she had dysmenorrhea for the past 25 years. She required medication on a monthly basis for pain control. As a girl, she received an injury requiring 5 stitches in her lower leg. The scar was not particularly apparent, but it was slightly depressed and it was a little numb. After 3 1-minute treatments, the woman became pain-free. Now that is phenomenal. After 3 1-minute treatments, the location of the scar was at the acupuncture point called spleen 6. Now that would be on the outside of your ankle, on the outside of your leg, right below the calf area is where spleen 6 would be. You can Google it. You can figure it out, okay? It says that the location of the scar was at the acupuncture point called spleen 6. Subsequently, the scar is no longer depressed or numb, and the scar is not causing any distress or discomfort in the patient. Now, it says for the first time, okay, after they worked on the scar, the lady had absolutely no pain on her period. Okay, so that is phenomenal. Why is that? That is because they released that blockage, that scar tissue blockage, that energy could flow, and so she didn't have to have any kind of pain meds. Now, I just want to back up a little bit because you're asking, I can hear you, how is your leg connected to your uterus? I'm glad you asked, right? If you Google the fascia chart of the human body, you will see that everything, musculature, everything is connected to everything else. I go and see a myofascial specialist. Why is that? If you know me, if you know who I am, you know that I have been diagnosed with a hip problem, and I am avoiding surgery by taking care of different things in different ways. The myofascial specialist right here in Kingwood, let me know if you need his name, he's awesome. He works with my muscles to get my muscles sliding again the way they're supposed to. So with a scar, my spinal scar, and the iceberg underneath had affected the muscles in my lower back, the muscles that connect my spine to my tailbone. It had affected the muscles in my pelvis. It had affected the muscles in my shoulder blade, and it affects the muscles in my neck. And so while he's working on me, on my neck, and it feels good, it's a nice massage, it doesn't hurt at all. While he's working on me in my neck, my hip is leveling out. It was tilted, it was twisted, and when he's working on my neck, my hip just goes into place. It's like, how is this happening? And so he showed me a chart of everything is connected to everything. So when one thing is damaged, it goes out, the tentacles, for lack of a better word, go out to all the rest of your body. And so you can have all kinds of issues, all kinds of other ways. And so we don't want to do that. If you have had we'll say a traumatic car accident, that's trauma. You have had to go into the hospital for life-saving surgery, and thank God we have that. Nonetheless, you are traumatized. There are emotions wrapped up in that scar, and so if you would have scar tissue release, you would release the collagen that's bound up that is impeding blood flow and lymph flow. Blood flow brings nutrients into the area. Lymph flow takes debris out of the area, takes the toxicity, takes the poison, takes the viruses, takes the bacteria and the mold and whatever else we have in our body, takes it out. So when we've got blood supply and lymph supply that's damaged because we have a scar tissue blockage, that's going to impede our physical movement and our physical well-being. If we also have that emotional trauma locked up in those scars, then that's going to affect us on a mental, emotional, and spiritual plane as well. So all of this is really important, which is why when I had my first treatment, I had a little bit of tear going on, which was bizarre because the doctors had told me that if I did not have the scoliosis surgery, I would be in a wheelchair by the time I was 16. I was 12. So I was excited that I was not going to be in a wheelchair. So there was no reason for me to have a negative emotional connotation. However, there was anxiety going into the hospital. There was a little, the fear of the unknown and all that kind of stuff. And all of that was trapped in the scars. So when we're working with this, we are actually reducing that as well. So what emotions can go with scars? It can be low self-esteem. It can be sleep disturbances, loss of libido and sex drive, anxiety and depression, anger, fear, self-loathing and self-image problems, and then feeling that the body is disconnected in some way. So this is what people report, okay, about their bodies. And so we're going to talk to you about some different things with the scars. I'm doing okay on my time. Bobby says conventional doctors and chiropractics say there isn't anything they can do for the neck pain and the headaches. Is there anything I can do? And yes, let me just tell you, I am doing the myofascial specialist. He is here in Kingwood, but they're all over the Houston area, so they're probably in your area as well. I'm also working via Zoom with a neuro Pilates lady, okay? And that is reprogramming the brain to reprogram the way the body's working. So if you've had a scar for a long time, you have learned incorrect movements. The body has overcompensated in another way. And so you might have to have some brain retraining like I am, because I want to have 100% fluid movement back. And you can have that too. Yes. And Bobby, the doctors say there's nothing that can be done for me as well. However, I am living proof that things are improving, things are getting better. And so we've worked on people here in the clinic, and we'll put those pictures up, that had range of movement issues. And the doctor said nothing could be done in just 4 treatments. There is no impediment in the movement there. So doctors don't know everything. We're glad that they know what they know. There's other knowledge that they don't have, and that's what we're bringing to you today. And so I want to talk about disassociation. Disassociation occurs when something happens to your body. Now, I would think that this would be really, really traumatic, like a car wreck, or our soldiers that come home and they've had to have their limbs amputated because of all the things. All right. A 55-year-old man had surgery for ulnar nerve entrapment. Okay. So your ulna is right here in your arm. You've got your radius, radius and ulna that does this. Okay. So the ulnar nerve was entrapped. It is a nerve that hurts when you bang your funny bone, okay? The scar was about 4 inches in length. Now it's about 3 months after surgery, because he had to have that nerve entrapment, all right? He described the elbow scar as being numb. In his own words, he felt that his arm no longer belonged to him. He had already disassociated himself from his arm because of the lack of feeling in the scar. After just 8 or 9 minutes of treatment for the scar, I asked him to recheck the feeling of the scar and tell me if anything had changed. Yes, he said, with his eyes wide open in amazement, I can feel it. And his next words were very powerful. It is just as if I got my arm back again. So the trauma was so bad that he had pulled away from his own body. That's no way to live, people. All right. It says a disassociation he had experienced for weeks after the surgery disappeared. During the fact that he could now feel his scar, he once again became more in touch with his arm, and no longer did he feel that his arm did not belong to him. All right, so that's really, really important. I want to talk to you. I think I have time for one more. I have tons and tons of stories here, and we're building our own stories here at the clinic too. So I can't wait for you to come in and let me work on you so you can have your own success stories. Kim, we're going to talk about Kim. This scar is from my cesarean section from August 2021. In October 2021, I got my first treatment for this scar. The scar affected Kim in many ways. Before the scar treatment, I felt that my body was restricted. The scar was tense and it pulled my body forward and downward. My belly was swollen in a strange way and I had problems emptying my bowels. I also felt that the scar affected me psychologically. I felt low and sad and I was very tired and worn out. Kim continues, sometime I also had terrible pain both in the scar and in my abdomen. I could barely walk or even rotate my upper body. It is, of course, not so strange that it can take time to recover from pregnancy and childbirth, especially after a large surgery of the abdomen. People told me it takes time, give it time, not to expect to be able to move and not to be able to exercise until a longer time had passed. She said, but I felt there was more to it, both emotionally and physically, and that the scar just needed more time. I could not accept that this was that my entire maternity leave would be wasted for me to recover. She says, luckily, I found my therapist, and she gives the scar treatment. I contacted her right away. 10 weeks after my C-section, I had my first treatment. The first time, halfway through the treatment, Monica asked me to touch my scar, and I immediately started to cry. It felt like me. I'm gonna cry. It felt like me, and I could feel my belly, and I dared to touch the scar, which I had never dared to do so before. It was a wonderful feeling that my sensation had returned. Directly after the first treatment, I could squat down and tie my shoelaces. I flew out of Monica's clinic with my head in the clouds. Everything had eased, and I felt happy and free again. I mean, if that doesn't touch your heart, I don't know what to tell you. You know, our whole bit here at the clinic is to help people regain their health, regain their lives. And we can work on you on the inside with supplements and nutrition and lifestyle changes and all that kind of stuff. But if you have scars, and who doesn't? The average person, the statistics tell us the average person has 5.5 scars. How you get a half a scar? Nobody really understands that. However, that's what they say. And so if you are one of the multitudes out there with a scar, I'm just telling you, it is impeding you. And if you are having range of motion issues, if you're having depression, if you're having loss of energy, if you're having no sex drive, it could be scars that's causing that. I will just tell you, I've worked on quite a few women with appendectomy, tubal ligation, hysterectomy, right? And they all report increased sexual response. So if that doesn't move you, I don't know what does, okay? So it is the weekend. I've got tons and tons more stories, so maybe we'll do a little bit more at a different time. But it is the weekend. I want you guys to enjoy yourself, do some self-care, do some self-love, take care of yourself. I'm going to post some links here where you can do some more research for yourself. If you think that this is a therapy that you would like to try, we'd be more than happy to help you. I would just tell you, I think there are only 26 therapists here in the United States. Now, why is that? Well, because the United States is not open to alternative therapies very well. It has been going on for years and years in Europe. Alistair McLaughlin is the developer of the technique. He is a British man. He now lives in Germany, if my research is right. And they've been doing it over there for years and years and years. Here, not so many years, maybe 2 or 3 years. So there's nobody else in the state of Texas that is certified to do this. So if you want to do this, then come see me. Or look on the map and you can see in your own area if there is someone there. But I'm going to tell you, it's going to be few and far between. If you want to learn this technique, there's resources that we're going to post as well, because with 28 million surgeries per year, we have a lot of work to do. We have a lot of work to undo, okay? Take care of yourself, enjoy your weekend, and I will see you next week.